Welcome, colleagues. It is a pleasure to welcome you to the second webinar of the Uniting Efforts for Innovation, Access and Delivery series of webinars. COVID has demonstrated in real time the importance of uniting our efforts for innovation, access and delivery. And you're going to hear today from a number of exciting participants about making the case for investing in neglected tropical diseases. As we respond to COVID, we also need to make sure that we're still able to and have the capacity to respond to other diseases as well. We have over 240 registered participants with us today. So without much further ado, let me introduce a longtime colleague, Dr. Satoshi Ezue. He is the Director of Global Health Policy Division, the International Cooperation Bureau of the Ministry of Foreign Affairs from Japan. He's worked in Japan's public health and global health arena for more than 2 decades and currently serves as the Director Global Health Policy Division. He's held that post since August 2020. Prior to that, he's held a number of high-level important posts working on the area of health. He was most recently a counselor of the Permanent Mission of Japan to the United Nations, where he led and was facilitating the UN General Assembly high-level meetings on tuberculosis and universal health coverage. He's a medical doctor and a PhD and has completed 2 master's degrees from Harvard in public health and public administration. We've been working closely with him in his different capacities for many years now at UNDP, and I'm really delighted to welcome him this morning, or this afternoon or this evening, depending on where you're joining from, to kick us off. So Dr. Ezue, over to you, and you're very welcome.
Thank you, Mandeep, for the kind introduction. So this is 11 p.m. in Tokyo, so this is good evening from me, but good morning and good afternoon for everyone attending this webinar. So on behalf of the Government of Japan and the partners of Uniting Efforts for Innovation, Access and Delivery, it is my pleasure to welcome you all to this webinar on making the case for neglected diseases, leveraging national investment cases to unlock financing for access and delivery of health technologies. Uniting Efforts is a partnership between the Government of Japan, UNDP-led Access and Development Partnership, and Global Health Innovative Technology Fund, GHIT Fund, and our aim is to bring together stakeholders, including funders, governments, innovators, product development partners, and organizations and platforms focused on the strategies to improve access and delivery of health technologies for neglected diseases. We are delighted to have almost 250 registered participants and a very distinguished panel of expert presenters and speakers. So achieving the health-related goals and targets of the 2030 Agenda for Sustainable Development, including universal health coverage and the SDG 3 goals to control TB, malaria, and NTD, requires collaboration between stakeholders involved in the discovery, development, and delivery of health technologies, and it is in that spirit that the Uniting Efforts global platform was launched in January 2019. The Government of Japan takes a holistic approach towards global health by supporting both the GHIT Fund, which focuses on product development, and the Access and Delivery Platform Partnership, which works to strengthen health systems for access and delivery at the country and regional levels. The ADP is led by UNDP, led by Dr. Mandeep, and Systems for Access and Delivery at the country and regional levels. This platform, ADP, is led by UNDP in core partnership with WHO, TDR, and PATH. Uniting Efforts aims at bringing together all relevant stakeholders to collaboratively find solutions that facilitate innovation, access, and delivery of health technologies for neglected diseases. For the purpose of uniting efforts, neglected diseases, including NTDs, TB, and malaria. Since the launch of Uniting Efforts, we have convened several global dialogue and technical meetings that have helped develop a common agenda around two initial priorities. One, how to better anticipate and plan for access and delivery early in the research and development phases of new health technologies. And two, how to develop innovative and sustainable financing so that health technologies can reach communities that need them most. This webinar is a follow-up to the first webinar on 2nd of July this year on financing for access and delivery amid a global crisis, where a landscape on financing opportunities was presented and builds on that to showcase how investment cases can be used to unlock these financial resources. The aim of this webinar today is to launch a new publication commissioned by Uniting Efforts, a guidance note for the development of national investment cases for neglected diseases, developed by consultant Dr. Rachel Nugent at RTI and her team, and also to bring together neglected disease and investment case experts to discuss the opportunities and challenges involved with using national investment cases as an evidence-based strategy to mobilize financing for neglected diseases, set up priorities, and create opportunities for advocacy and multi-sectoral approaches to health. Investment cases are not a new tool. They have been used successfully to improve health responses for other priorities, including for NCDs and HIV/AIDS. We are delighted to have the opportunity to explore how they can be helpful and used to improve health and financing responses to address other neglected diseases. The timing of this discussion could not have been more important, as the COVID-19 pandemic strains already limited health resources around the world. Neglected diseases can be even more neglected. Now is the time to redouble our efforts to ensure that vulnerable communities can access necessary tools to protect against neglected diseases and that no one is left behind. Without financial resources to boost R&D and make health technologies available to ensure access of these vitally needed health technologies and to strengthen health systems that deliver those technologies to those in need, it is almost mission impossible to achieve the SDG goals of universal health coverage and health for all by 2030. Strong homegrown investment case are a key tool to identify priorities and mobilize the needed financial resources, while creating sectoral and government-driven responses to these priorities. I look forward to the presentation of the guidance note being launched today, the expert panel discussion, and the contributions by all the participants. I'm confident we will have a lively discussion. I hope the discussion today will not only help us inform the next steps of the Uniting Efforts global platform, but will also complement the important efforts by partners, including the WHO NTD department and the implementation of the new WHO NTD roadmap. With that, I would like to declare the session open and look forward to the discussions. Thank you. And back to you.
Oops. Thank you so much, Dr. Ezra. Can everybody hear me? Yes, there we go. Thanks so much for your inspiring and I think strategic opening. It sets the scene quite well for us in terms of the importance of investment cases and the potential for using investment cases, which have been used in many other areas of health now, for neglected tropical diseases. It's my great pleasure now to introduce my colleague, Doug Webb, who has been together with Rachel Nugent and others spearheading the work on investment cases for health in UNDP. And I cannot think of anybody better to moderate this session with his long and deep experience on the issue of investment cases and how we can use them most effectively. Over to you, Doug.
Hi, Mandeep. Thanks for that introduction. Thanks, Dr. Zoe. Can you all see me? Can you hear me? Greetings from New York. We've had a long night here. It'll continue, I'm sure. Welcome everybody to this, what should be a very interesting conversation. As Mandeep said, I'm in the HIV and health team. I manage the health and innovative financing component of UNDP's work. And my job is to help go through this next hour and a half, looking at investment approaches for neglected diseases. And I think it's going to be a very interesting conversation. We've been working on investment approaches now for some time in different disease areas, and I think this is a new approach for this particular group of health conditions. So I want to just sort of maybe just throw out a couple of questions that I hope the webinar zeroes in on. What are we trying to get out of this next hour and a half? Obviously, we want to launch the guidance note with the help of Rachel on investment cases. It's not a guide, it's not a methods package, it's more of a case as to why cases are important. We want to really discuss the value of investment cases themselves as a tactic, as a strategy for raising awareness, for looking at how incentives are aligned or not aligned across different actors, for examining the sort of the fiscal space and the opportunities or the constraints and challenges. And I think possibly most importantly in this area, how the different actors in the neglected disease communities have different experiences and contributions to make from their own backgrounds. I've been engaged in various, perhaps in the TB community more than others. And I know the modeling experience in that community is very strong. So how do these communities come together and synergize perhaps and support a mutual effort in terms of investment approaches to raise awareness across these conditions? So to facilitate linkages between the global conversations and dialogues as they link to the SDGs at a global level, and we're going to be talking about the WHO NTD roadmap and the global investment case, and then the conversations at national level. And one of the things we've learned around investment case approaches is really the importance of kicking up the dust at national level, getting into the mechanics of the government decision making, the interactions with partners on the ground, and really asking tough questions about, this is valuable work, why aren't you doing it? The returns are obvious. If you're not pursuing this policy, you are, in a sense, deliberately wasting money. And we found that narrative of seeing a return and not pursuing the policy option as a form of policy neglect, and bringing on media and civil society is a very powerful tactic, which policymakers and politicians in the media can be attracted to and shamed by if we do it well. So I'm hoping that we sort of touch on some of those issues from the different speakers today. Now, some of the housekeeping stuff as a moderator I have to cover. You'll see covering my face on the screen. I have to move it so I can see what I look there. I'll put it back over my face. There's a poll has appeared magically. There'll be a few of these popping up. This will be interactive as a webinar. These questions are not tough. You'll have a gut reaction almost every time, I'm sure. We politely ask you to fill them in. There's no rigging of the results, you'll be pleased to hear. We'll count your votes in real time. The results will be available during the webinar, not on Friday. And we'll discuss the results as they are coming in. So please answer them. It's just to help us understand where we are together around the questions that we're raising. We'll talk about the results, and you know, it'll feed the dialogue. So they'll be coming up. Please have a look at them, and also at the bottom, you'll be familiar now, we're all experts on these things. You've got the chat and the Q&A. Now the chat is for basically for you to say hello, to introduce yourselves, to observe, to make comments, to say that was nonsense, I like that point, whatever it is. The Q&A is for you to raise a question that you'd really like us to be aware of for the panelists perhaps to respond to. So see those slightly differently, and the panelists will be looking at the Q&A in a more formal sense to respond to. So the chat is for the chat and the Q&A is for the Q&A. Let's just sort of put it like that. The webinar will be recorded and posted on the Uniting Efforts website. And the bios of everybody will also be there, as is the advanced copy of the guidance note itself. So let's get on with the real interesting stuff. Delighted to have Dr. Rachel Nugent with us today. We've worked together on a few cases over the last few years. She is officially the Vice President and Director of the Center for Global NCDs at RTI International, and helping the uniting efforts on moving ahead on the investment cases approaches, and helped with the guidance note development. So I think an ally for all of us, and this guidance note is really a very compelling case as to why we should be doing this collectively. So Rachel, you're very welcome. Over to you to take us through the essence of the guidance note. Thank you.
Okay, thank you very much, Doug. Can someone give me, let's see. Okay, there I am. Can someone give me a signal as to whether you can hear me? I hope that you can. Any signal? I'm going to just proceed. Oh, okay, good. You can. Thank you. Thank you, Ali. All right. Thank you very much, Doug, for that kind introduction. Thank you to all the Uniting Efforts partners. This has been a very interesting process. And I'm here to launch this guidance note that we were asked to prepare. Not because I'm an expert on neglected diseases, but because I guess I'm somewhat of an expert on investment cases. And that's really what we want to do today, is to have everybody get a good exposure to what an investment case is, what it includes and doesn't include, and what it can do, most importantly. And then feel empowered to answer that question of, is an investment case a useful tool, the right tool to use right now to answer some of the very important questions in the areas of neglected diseases that you all work on. So without further ado, let me see if I can't share my screen and get us going in the right direction. Start from the beginning. Yes, please do. Okay. I think we've got it, if I can find the right buttons to move us along. Okay. So what we're going to do is draw on the experience that we have doing investment cases, largely for non-communicable diseases, NCDs, and their risk factors for entire countries, for global cases, and for subpopulations. And that's one aspect that we will be talking about in the discussion, is that choosing the focus of the investment case, the scope of it, and the focus of the populations that you want to study. That's one of the first steps. Here we go. And I'm gonna, give me just a second here so I can move myself and others out of the way, and maybe we can see the slides better. So the terms of reference were to prepare this guidance note to explore the usefulness of investment cases as a means of mobilizing funding for technology access and delivery for neglected diseases. It was stimulated at a 2019 consultation that was held by the Uniting Efforts group. Much discussion about the need for additional funding and how to mobilize it. And the idea emerged from that meeting a little over a year ago that it would be useful for the group to study the investment case process. And that's what the guidance note is all about. As I said, we developed it based on our learning from other investment cases, and as well from a whole series of interviews that we've done with Uniting Efforts partners and other experts in neglected diseases. And what we're trying to do here is answer, what is an investment case? Why develop national investment cases for neglected diseases? And what should national investment cases for neglected diseases include? Now, I don't have time in the presentation to talk in detail about all of those questions, but I definitely want you to understand what is an investment case by the end of this. And I'll give you also some things to think about in terms of the why and the what should they include. So let me start with what it is not, because there are a lot of terms used, and as both Mandeep and Doug have mentioned, and Dr. Ezoe as well, investment cases are not new. There are a lot of them out there, and we will touch on some of those examples later on. But it is not a business case, although that term is often used, and I don't have an objection if that's what people want to use. But in particular, a business case focuses on a product or a portfolio of products to determine an investment decision, very often from an investor perspective, sometimes from a societal perspective, which is often what we take with an investment case. So they have been used interchangeably, but I want to put it out there that should you hear that term and the term investment case and scratch your head and say, are they the same or not? They aren't really the same, although, again, some people may use them in the same way. An investment case is not a health impact analysis either. That is a method and tools that are used to look at the impacts on health of a population of a non-health policy plan, program, project. For instance, a water construction, water infrastructure project. That is going to have health impacts for certain. And a health impact analysis will describe those, outline it, and very often be part of making a decision about whether to go ahead or not. But that is not an investment case, either for health or for the water project itself. And then an investment case is not a cost effectiveness study. We use cost effectiveness results in an investment case, but CEA compares the costs of health programs to health outcomes that they generate. And they're very common, particularly where there is capacity for health technology assessment as a way of deciding what the public sector will pay for. CEA is good for other things as well, but very importantly, it does provide important evidence about what the health sector will or won't pay for in a benefits package. So on to our main topic here, what is an investment case? As I said, they have become one of the desirable tools, particularly for the Ministry of Health toolbox. And as Dr. Ezeway said, they are common, but the Ministry of Health often finds it very useful to take an investment case to the discussions with the Ministry of Finance about providing health services. That's often the very first thing that comes up. So what is included in an investment case? There's a long list here of elements. And the main point is that an investment case pulls these together in a systematic fashion, somewhat predictable fashion, to answer certain questions. And so ministers of health and their colleagues and ministers of finance and their colleagues are accustomed to having evidence and information presented in this way. It includes the disease burden for a given scope of diseases. It looks at the policy environment for feasibility. It uses evidence, as I said, cost effectiveness evidence to indicate what are the most effective and locally relevant interventions. Recall that if something isn't effective, it can't be cost effective. If it's not cost effective, it doesn't belong in an investment case. So those are some of the sort of necessary conditions. We look at coverage levels for the set of interventions, policies, and so on, relative to UHC, increasingly relative to UHC and what the country wants to offer. And we define pathways to scale up to achieve UHC goals. Excuse me. Importantly, and Doug alluded to this, it identifies bottlenecks, or whatever you might want to call it, bottlenecks, barriers, problems, to access affordability and acceptability of health technologies and of the interventions included in the investment case. And that is a really important aspect I'll come back to, which is that a lot of these things are not explicit, have not been actually recognized and discussed in a country. And I'm speaking here particularly about country level investment cases. They haven't been discussed. They've been either swept under the rug or not even recognized. And an investment case sort of brings them to the forefront, surfaces them for discussion. An investment case, of course, measures costs and benefits. That's what we think of as sort of the raison d'etre of an investment case, to give us an ROI, return on investment, for doing a set of interventions. It frames health spending against the need and sometimes identifies solutions to funding gaps. There's a scope that could be discussed there. And that all gets condensed into these two main components, at least in the way that we've been doing investment cases with our partners, UNDP, WHO, and the countries that we work in. We produce an economic analysis, and then what has been called an institutional and context analysis, the ICA, which is pretty self-descriptive there. So you have the quantified part, the quantification, usually using an economic model that is developed for the particular kind of investment case at hand, but then we can use it in multiple countries because we want to be systematic. We want to be able even to compare investment cases across countries if that's desired. So that's the quantification part. And then the ICA provides a lot of qualitative information. As I mentioned, the most promising policy pathways, roadblocks, bottlenecks, etc. It brings in guidance, normative guidance, and it assesses the political appetite and opportunities, which is, again, one of those key aspects that your Minister of Health really wants to take advantage of. Is this the right moment or is it not? How do you determine that? This provides a systematic way of answering that question. So here is a table that just gives a few examples of some of the pieces that go into an investment case. On the left-hand side, what do we put into an NCD investment case typically? And then on the right-hand side, what might go into a neglected diseases investment case, again, depending on the scope, the needs, the location, et cetera. So this is just notional, but it's to give you a little bit of insight into the black box part of it. So we need to determine the perspective up in that top row there, the second to the top row. Is it a societal perspective? Yes, I think we can all say that's the most desirable approach for an investment case, is to take a broad perspective, assuming that we're talking about public expenditures, then the society's interests need to be front and center. It could alternatively be just a health sector perspective, particularly where we're looking at a narrow investment case scope that really only does concern health sector inputs and expenditures and impacts. But I think for neglected diseases, we know that it goes beyond the health sector, that what is done and how communities are affected is more than just their health. Timeline, what is the right timeline? That too is to be determined by the particular case. Typically, we're looking at the SDG 2030 time period to align with that time frame. For neglected diseases, it could be framed in terms of 5-year plans, the SDGs, the WHO roadmap. It could be really extended to try to incorporate all of the costs and all of the benefits of the investments being made. In particular, for neglected diseases, the time period needed to break transmission to achieve elimination or eradication goals. So it could be extended out further. And we've done some investment cases on adolescent NCD risks that go as far as 50 years out to allow for those adolescents who have been, let's say, intervened on, who have been provided interventions to improve their health and risk-taking behaviors, to allow us to measure those long-term benefits. The target population, as I mentioned, for NCDs, typically adults, because that's where NCDs land, unless we're talking about those important risk factors that start early in life, which they do, of course, even before adolescence. For neglected diseases, children and adults at risk could be just endemic countries, of course, potentially looking at subnational populations as well, those who are living in certain areas or are in extreme poverty who may be most at risk. And it can be disaggregated by different groups, even by income quintiles if the data are available, to look at equity impacts of the interventions under consideration. And then turning to those interventions and the platforms, what is relevant, what is not done yet maybe, but to be tested, that an investment case can inform on. So for NCDs, we have the best buys from WHO that are all well-evidenced, cost-effective, proven to be scalable, et cetera, clinical interventions, prevention, and so on. For neglected disease, what might that include? And this, again, is your community, not so much my expertise, but preventive chemotherapy via MDA, or perhaps more integrated into the health system, maybe moving away from MDA, vector control wash, expanding diagnosis and treatment, including with new technologies, and additional interventions to facilitate delivery. Those, of course, are all among the things, and there are others I haven't mentioned that may be included in an investment case scope. So I want to emphasize something here with this little bunch of pleasant pictures. A particularly valuable aspect of investment cases is to be able to quantify the impact of reducing disease or improving health on different kinds of outcomes. So we think about the economic outcome, the economic productivity here mentioned. We do measure the improvements in productivity from improving health. And this goes way back to the 2000 WHO Commission on Macroeconomics and Health. How can health be an investment, not just thinking about it as a cost? And one important aspect of that is measuring the improvement in productivity and the consequent improvement in GDP. That's very important to the Minister of Finance. But also other sectors are involved. Education, for instance, very important in the neglected disease world because children are so at risk and their education, of course, is compromised when they have recurrent bouts of neglected diseases, when they can't get to school, they can't study, their cognition is affected, etc. And then, of course, the health components measured in a whole variety of ways that may be important to a particular community, averted cases, averted deaths, of course, etc. So I just wanted to underscore that because in that regard, an investment case can help build a coalition across sectors. When you include the impacts on these different sectors, you include their interests and they are part of the dialogue. And again and again in the countries that we've been in with Doug and his team, we see that it's the process of this dialogue. It may raise, I think Doug said, kicks up the dirt. It can kick up the dirt. It can raise some discomfort when our conversations drag in the Ministry of Agriculture, for instance, and they haven't really been a part of the discussion around taxing certain unhealthy products, as an example, for NCDs. But it's very valuable to have that discussion, and they see the need to come to the table. So moving on then, a little bit more detail into the black box, the ICA part of it. There's lots of steps here. It's a very busy slide. I'm not going to go through the whole thing in the interest of time, and there's lots more detail in the guidance note that we're launching. But as I've alluded to, you want to define the scope of the problem. You want to define it within the context, the political context, the opportunity context that you're sitting in. You want to determine the institutional and governance arrangements, assess resources, what are the drivers for change, determine where the evidence is in terms of the priority actions and which supporters might be there or which obstacles might be there, and then evaluate the enabling factors and strategies. Each of these steps is part of the very extensive interviewing and document research, evidence research that happens in the investment case that our UNDP colleagues are very expert at. So let's move to the main question at hand, I think, that's on your mind. Why would you want to have an investment case for NTD, malaria, and TB access and delivery? And I hope I've answered some of the questions. I know that the question is probably already there in your mind and you're looking for answers. Well, one very obvious one is what prompted this guidance note originally, which is how can we mobilize more funding for neglected diseases? We did this little analysis here by putting together the available information about what was being spent on R&D, so public-private philanthropic R&D funding for neglected tropical diseases, along with IHME's financing global health tracking of development assistance for health. So it's a little bit apples and oranges. R&D and development assistance are not exactly the same thing, but it's a question of what money is going into funding. And here we looked just at NTD, so just a part of the scope here that we're discussing. But you can see $57 per dollar. You can see that the funding internationally available for both R&D and for programs and projects that are supported by external funders and donors is quite low, even compared to malaria and TB. Not on a per DALY basis, but on an overall basis. And on a per DALY basis, all of those neglected diseases are quite low compared to AIDS, of course. So that's just one. I think you guys working in this area know very well that more resources are needed. This is one way of looking at it and demonstrating that that relative to the burden of health and relative to financing for other areas, these diseases are neglected. What else? We asked some experts working in the fields of neglected diseases, what would you see as the added value? Are there compelling ways to frame the argument for investment that can spur governments to act? Considering the pipeline, how will the pipeline for new technologies change the field, change it in terms of what's possible to do for elimination and eradication and control? And then what might be the bottlenecks, the roadblocks, the barriers to implementing new technologies and how should that be done and where? So we asked a lot of questions and we got a number of very interesting answers. Here's just a couple little bullet points. Again, the guidance note has much more, but we heard the feeling that neglected diseases are often invisible, particularly NTDs, but also can be malaria and particularly, again, TB, which may be more, I don't want to say isolated, but more visible among certain subpopulations, but not visible to the whole population or to the decision makers because it's segregated into subpopulations as with NTDs. So the priorities need to be raised. The landscape is changing in regard to technology development, which is a very good thing. And there's a need to understand the implications of those changes for programs, for the pipeline, et cetera. And again, donor-driven financing can often preclude the hard discussions in countries, the hard choices that have to be made, because they are hard choices. There's never enough resources. But the investment case process raises that discussion to a level that is necessary across the sectors. So moving just to a few examples from our own experiences, what an investment case can accomplish. Again, I've mentioned the barriers and the opportunities for advocating. Investment cases are very often, first and foremost, an advocacy tool. I don't want to overemphasize that, although I think that's often in the minds of the ministries of health and the other stakeholders that come to us for an investment case, funders do as well, is that they want to advocate for additional resources. They want to advocate for action, which is absolutely important. But again, as Doug and I have alluded to already, it also forces a dialogue, it forces a discussion, it raises to the surface some information and evidence that may not have been in the forefront before. So in that regard, it helps to build that health coalition and to speak other languages. And then it advances policy change. And here are a few examples. Again, a busy slide. I know I'm just about out of time. So in the interest of time, I'm not going to even talk about any of these examples, except that there are many different kinds of policy change that we've seen emergent from the investment cases that we've done in countries, from funding to strategy discussions, to decision-making, to specific policy proposals that get passed in different countries. There are a lot of investment cases out there. We've told you that several times. The examples that we give here and the citations, they're all available to you. These are all global investment cases for health, for neglected diseases primarily. We have RMNCH here as well, a global investment framework from WHO, a mental health investment case at the global level from the World Bank and WHO. And in the areas of neglected diseases, there are many. They're not all listed here for TB, for instance. But I do want to draw attention to the two at the bottom, which are relatively new. Breaking the Cycle of Neglect was published just a couple of months ago by the Economist Intelligence Unit on parasitic worms in sub-Saharan Africa. And then just about a week ago, the investment case for neglected disease late-stage product development from Kevin Yamey and company at Duke, which was published as a working paper just recently. Those may interest people on the call. They're all examples, but they're not country examples. And there's an important connection between what the global investment cases can tell us and can do and can advocate for, and then what countries need, the information they need to draw on, and the questions that they have. So for the key stakeholders here, I think it goes without saying that our guidance note suggests that there's value to these different stakeholders for different reasons. But particularly I want to underscore for access and delivery stakeholders, governments in countries and civil society in countries, raising the visibility of the needs, identifying strategies and interventions that work, that can galvanize financing by looking at the return on investment and how it compares to other choices, how it compares across a range of interventions for neglected diseases themselves that need to be chosen from. That's something that provides value in a systematic way. So finally, just turning to next steps, we want to be sure that everyone who may be interested in this is familiar with the opportunities, familiar with the examples. The map shows where we have done and will be doing investment cases with our colleagues at UNDP and WHO. We've covered quite a lot of territory in just a couple, 2-3 years. Doug may remember, maybe it's been 3 years, but there's a lot that can be done in a short amount of time when you have agreement and the will and a method that has proven that it works. And so we suggest that the next steps are to develop that method in some detail. That's not what the guidance note is. To convene the people that do bring the expertise for financing, the disease expertise, the ministries, and the people that are there to implement and to address those questions together of how broad or how narrow should an investment case be, and how to integrate it with other important things that are happening in countries, particularly, of course, UHC and the COVID-19 agenda, and to develop and complete some investment cases that will achieve impact. So with that, thank you very much. It's been a pleasure to deliver this to you, and I look forward to our discussion. Back over to Doug. Ooh, I have to stop screen sharing, don't I? Give me a moment.
Thank you, Rachel. I think I'm back on. Wonderful stuff. Great. We spent hours talking about this. Two very rapid reflections. I know time is against us. The impacts of these cases, I think, are in two phases. One is actually when you're doing the conversations and kicking up the dust in country. You often see the dialogue itself having an immediate impact on the attitudes and the understanding of the stakeholders you're interacting with. You do see ripple effects at the time and in the immediate aftermath of going into a country and having the dialogue itself. And we've seen that. The second is when the results are actually presented, which might be a month or 2 months or 3 months later in a formal launch event of the numbers themselves. And those impacts can be on the fiscal decisions of a country, or particularly on the legislative decisions of a country. And the timing and the interaction of those, the metrics, the economic rationale into the legislative and the political space, I think is where we've hit a sweet spot in our experience. And making sure that the economic argument, the rationale for investment interacts directly with the political cycle. This is why the return on investment time frame, interacting with the political cycle and its incentives, is so important, rather than being unaware of the political incentives. You can basically say, here are some policy decisions that you can affect that will make you look good in the eyes of your bosses politically, and even in the eyes of your electorate. And now that is where you then start seeing traction effectively through this process. So thank you, Rachel, for that. Now, Judith, can you whip up the results of the first poll so we just see where we are on the first poll? Is that possible? While the second questions are on the screen, it'd be good to see what the first poll has come in. If we can do that. The biggest obstacle you expect to encounter to mobilize financing: lack of data. Well, there you go. The principal purpose of the investment cases is to produce data. So that is then, in this respect, looking at the demand for why these are important. The second question, I think the other questions are going up, the polls are going up, so keep answering the polls. It's all very helpful. Let's go to the panel. We've got 4 panelists. We have Dr. Mwele Malachela, who's the Director of Department of Control of Neglected Tropical Diseases at WHO. I'll just introduce their names and then I'll introduce them properly when they're about to speak. Thokozile Phiri-Nkoma, who's Executive Director of the Facilitators of Community Transformation in Malawi, an NGO. Sam Mayer, who's Vice President of Public Affairs at the End Fund. And then we have Dr. Brian Asare, who's the Senior Technical Advisor in the Ministry of Health in Ghana. So a good range of constituencies, different perspectives, who will be talking about the guidance as presented, reflecting on that and coming from their own perspectives. So we've got a good range of views. We're going to start with Dr. Mwele. from WHO. Over to you, Mwele. Thank you.
Thank you very much, Doug, and thank you once again to my colleagues at UNDP for the opportunity to speak about the the global investment case, but at the same time to appreciate the work that has gone into this guidance document and the presentation by Rachel, which was really, really very, very clear and several steps ahead in moving towards working with the countries in developing investment cases. So I'd like to start by talking a little bit, reflecting on our work on the global investment case, and finally to link this with what the work that's going on with the guidance document and the work that we hope we will together support countries in carrying out their own investment cases. So why do we need an investment case? This was very clearly articulated by Rachel. NTDs remain poorly funded, but more importantly, as we've set out very ambitious targets in the roadmap for 2030, they need incremental resources to achieve. So the targets are very ambitious, and it's very clear that we need to increase the amount of resources that are going in to addressing these targets, or at least making sure that we can address these targets or repurposing of some of the resources to address these targets. And there are definitely still missing pieces in the current NTD investment landscape that need to be filled in. And we are looking at 20 diseases and several items in the columns. So if you look at the columns, there's issues around technical progress, and there is where where most of our work on R&D is situated, and as well as the interventions. There's the strategy and delivery, and that's where we find access and logistics, and there are enablers. And when we look across, we find that there are some things that go across diseases. So we have issues like diagnostics, where we have gaps across diseases. We have gaps in monitoring and evaluation. We have gaps in access and logistics. And it's very clear that there has to be a way to invest in these issues for us to make progress towards the 2030 goals. So to answer the question, looking at how do you address an investment case for 20 diseases? And our investment case logic in looking at the global investment case was, first of all, the why. So of course, the why is clear: to protect the poor and easily ignored populations, and to accelerate actions of the roadmap, and to shift from being disease specific to more cross-cutting approaches. In the what, we are going to leverage, we decided to leverage the heat map to identify disease specific and common gaps. And then to talk more about improving efficiency, which is one of the keys of the roadmap, through integration, and looking at some country examples as well. And then finally, looking at other cross-cutting solutions for forward thinking. And then how much would be maintaining international investment to protect the hard-fought gains. So first of all, maintaining what we have, exploring new investments to support under-resourced diseases, and advocate for domestic financial targets in relationship to the overall PHC budget, and explore innovative financing methods and tools to improve program efficiency. Sorry. So as phase one, we have now completed phase one of this process, and we have looked at looking at all the economic arguments for all the 20 STDs, NTDs, estimating investment requirements for the critical gaps, identifying and assessing feasibility of innovative financing mechanisms to raise additional funds and attract new partners. Where we are now is where we would like to see better alignment and linkages with our colleagues at UNDP, and moving forward to support countries now to develop country-led country investment cases. And so we're looking at this for Q4 and going on into next year. And so I would like to just end by saying that this is a good opportunity. We do have an opportunity to align and really support countries to carry out investment cases that make sense in their context and their reality. And I think the tools such as the ones presented, the tools which we are thinking about will definitely support and support countries to do just that. Thank you.
Thanks very much, Mwele. It's a very important process that WHO is leading here around the NTD agenda. The challenge, of course, as we see it, is to try and bring the global mathematics and advocacy into the agendas of the ministries of health, and try and get those interactions going in a sort of a coherent dialogue. And I think that the tactic, if you like, of the investment case approach can do that, bring these sort of arguments together into one. So thank you for that. Thokozile, you're going to discuss some of the work of FACT in Malawi, and look at really the role of civil society in this. You know, what is civil society's contribution here? Is it advocate, service provider? Over to you.
Thank you so much, Doug, for the introduction. First of all, I just want to thank the organizers of this webinar, the government of Japan, GHIT Fund, ATP, and all the Uniting Efforts partners for organizing this webinar. It is indeed a great opportunity for us, particularly from the civil society, and a great honor for me as a civil society representative to at least share some of our experiences on moving forward the investment case work here in Malawi. So I'll give a civil society perspective. I'm the director of FACT, as Doug introduced me. Next slide, please. So first of all, here in Malawi, we as civil society have been taking part in a lot of work around health financing advocacy. But not much was done in terms of getting engaged in the issues of investment case and trying to understand how the rollout of investment case can improve or contribute to effective health programs in Malawi. So we got to have some interventions on investment cases in 2019. And earlier this year, when we got funding from one of our partners through a program that is funded by UNITED through the Impact for TB project. First of all, what we wanted to do was to advocate for adoption of new TB technologies. And of course, just to also mention that, as we all know, TB is one of the underfunded, but also under a disease that is not very well recognized in as far as health programming is concerned, but yet claiming more lives as compared to other diseases. So as civil society, through that grant, we opted to advocate for adoption of new TB technologies and tools, one of which was introduction and adoption of 3HP as a TB preventative therapy to be rolled out at a national level. And then what we also discovered through the engagement with various partners was that the tools were actually expensive for government, of course, the Ministry of Health, to procure and scale up and roll out. So what we decided to do was, first of all, to understand why it was hard for our government, and of course, most of the governments in other countries, to fully adopt this new tool. We were very convinced that adoption of this new tool was going to change the way TB was going to be managed, looking at the 2030 agendas of eliminating TB. So what we did was, first of all, to do a budget analysis to look at, the national budgets and the national strategic plans in terms of prioritization of such tools to be implemented. And then indeed, we noted that there was indeed insufficient funds to roll out these tools. After doing the budget analysis, what we did was, first of all, to understand, by way of developing an advocacy tool, an advocacy plan rather, to understand who are the key players to ensure that we have sufficient funding to adopt these new tools. And then we understood that the members of parliament, the legislators, were very crucial as they are key budget people who approve the budget, but also carry out oversight in terms of effectiveness of implementation of various programs at a national level. And then what we also did was then engaging the members of parliament through the budget committee of parliament, where now we presented our issues as regards to the insufficient funding, an issue that we had discovered. And just to also mention that one thing that we also discovered was a high donor dependency issue as regards to management of TB as one of the neglected diseases. And then the other issue was for us to also ascertain why, after a long period of time, we hadn't yet achieved the 15% Abuja Declaration for health financing. And with the various interventions that we carried out with the members of parliament, we also realized that there were a lot of competing priorities, and something that the members of parliament did attribute to, and did mention that even though there are all these priorities and key issues that as a government had to attend to, but there were other competing priorities that the government of Malawi, and of course I know it's the same issue with so many other governments in other countries. They couldn't adopt or ensure that there's sufficient funding for those other priorities. And then after that, we sat down, we went to a re-strategizing, we went down to the drawing board where we decided to do a landscape analysis to look at some of those financing options that could be there for us to go back to parliament, meet the budget committee and say, yes, even though we have all these competing priorities, we have this issue, but we could do A, B, C to ensure that at least we roll out these new tools, because these new tools have proven to have the ability to bend the curve in terms of TB management is concerned. After doing the landscape analysis, which was pretty much a cost-based benefit analysis, we developed a few recommendations that were presented to Parliament to improve, sustainable health financing for TB and, of course, other neglected diseases. So one of the issues that came up was the ability for Malawi to develop or establish a national health fund that would ensure that there's sustainable health financing. And one of the lessons that we learned was the National Roads Fund. So in Malawi, we have a National Roads Fund, which is very independent and self-sustaining, that is improving the road infrastructure and improving the transportation needs for most of Malawians. And we said, look at this case, and this is something that has been effective, and we can utilize the same to health as well. And one other recommendation was the National Health Insurance Scheme, and then also looking at possibilities for public-private partnerships. And then looking at all those three options, we went back to Parliament, meeting several parliamentary committees, the Health Committee of Parliament. We had interventions with the Ministry of Health, and of course, the Budget Committee of Parliament to present these three options that civil society brought forward. We also learned that through that process, the levels of engagement were very critical. We realized that high-level political leadership has been lacking in terms of promoting investment case work and advocacy. Next slide, please. Further to the work that we have done, we see a number of benefits of investment cases. So in the work that we did, we didn't approach the investment case as presented in the guidelines, but we took one bit of investment case approach, which was a cost-benefit analysis, which indeed showed and proved to be one of the effective models of increasing advocacy. So what we learned is that when we went back to Parliament, we had a clear advocacy strategy in place because we presented to them options which they could buy into. And then the other issue is that we see some of the key benefits of investment case is the ability to put together a wide variety of partners and investors, particularly in the private sector, who are not most of the times, not interested or not engaged in rolling out, health financing and resource mobilization. And then the other issue that we also saw as very critical in promoting the work around the investment case was the issue of universal health coverage. There is a lot of momentum. There's a lot of interest within the public and of course the CSOs regarding universal health coverage. And then we realized that, the discussion around universal health coverage was more focusing on financing, where for us, we thought the issue of investment case should not only focus on the financing bit, but also to pretty much look at some of the social outcomes that would promote the interest and the participation of wide sector of the public. And next slide, please. And so after everything we're done, so we're thinking, what do we need to move the issue, the investment case issue beyond policy to practice? Because we have also realized that most of the investment cases are pretty much at a policy level, where at the implementation level, we're really somehow a bit dragging. But we also understand that the several factors that could be contributing to such. And we thought one of which is the engagement of multiple stakeholders in the process. So first of all, is during the development of these tools, where it now becomes a national agenda, where all the stakeholders are part and parcel of the development process, particularly civil society, because we understand from the demand creation side of it, we need civil society who can go back to the communities, mobilize communities to be able to create demand for services and of course, the need for adequate financing. And then at the policy level, we have seen pretty much, for lack of a better word, I would say dominance of the Ministry of Health in ensuring that these policies are in place. But we also feel that civil society could also be part and parcel of this process to ensure that, these policies are there, and also to make sure that there's a little bit of accountability and transparency through that process. Because if we leave out, at the process of living out civil society and communities and those affected using the principle of leave no one behind, but also nothing for us without us, then would ensure that there's effective accountability. And then we see that we need everybody at the level of implementation, such as relevant institutions. We see that there are many private sector stakeholders who are very crucial at this point. In many countries, of course, I'll speak about
I'm sorry, I'm going to have to hurry you up a little bit now.
Right, thank you. And I'll speak about Malawi, of course, where we have a very strong private sector as well, and the faith-led institutions who have got hospitals, who've got establishments that can also provide a little bit of financing and options on investment case. And then the oversight level, which is something that I've already spoken about in terms of monitoring, making sure that communities and civil society are involved in the process. That was my last slide, and thank you so much for your attention. Thank you.
Toko. I'm sorry to hurry people up, but we've got a lot to get through. You brought up the point of the legislation, very important. You brought up the point of the parliamentarians and the political incentives, and also this idea that investment cases inevitably will be in competition with each other. There are, the Ministry of Finance is besieged by investment cases on an annual basis. They have to choose. They have to, they are not a neutral player. The investment cases have political values attached to them. So the numbers are just one factor in the policy dialogue. So within ministries of health, there are competing numerics. And then when they go into a fiscal dialogue, there are also competing sort of values attached to economic metrics. So how that interacts is very important. And I know there's some chat going on around that. Reminder to everybody to put your questions in the Q&A box. If we put them in the chat, they may get lost. So please, if you've got questions for the panel, put them in the Q&A box. Thanks, Toko. Over to Sam. Sam Mayer is the Vice President of Public Affairs at the End Fund. And we would like to understand, the End Fund is a big player in this area. And it's good to understand, what is the End Fund doing really in terms of looking at the delivery of health technologies in this? I mean, what is the role for a funder? I mean, in bringing in facilitating this area? What is the interest of the fund in investment approaches? Sam, welcome.
Thank you, Doug, and a huge thank you to our hosts, the Government of Japan, ADP, and the GHIT Fund, and of course my distinguished colleagues on this panel. Firstly, for those of you unfamiliar with the End Fund, we're a private philanthropic initiative dedicated to ending the 5 most prevalent NTDs. And we currently are investing in 25 countries' national NTD control and elimination programs. That can be by investing in governments directly for implementation. Sometimes it's through international NGOs or local organizations, but regardless, the investments are in tune with and in support of national plans, strategic plans to tackle NTDs. And in our view, sort of representing an ecosystem of partners, governments, donors, etc., investment cases are only ever going to be as successful as they are well designed, well timed, and well received. And I think this, to the topic of today, and the incredible work that Rachel, yourself, Doug, and the whole team has put into this guidance note, puts a big tick in the box next to well designed. I mean, I think we've got plenty of information to create comprehensive investment cases that can be very compelling when they do hit the desks of the Ministry of Finance. The timing is of course an important issue. Doug, you also used the phrase, I think, kicking up the dust, in terms of just understanding the mechanics of how investment propositions are put forth in front of decision makers at a country level. And I actually think this is an area where the NTD community in particular has a great deal that we can learn from the communities supporting other health conditions. So in particular, HIV/AIDS and malaria, and now having heard about some of the work in Malawi on TB, I think that too, because of course there are mechanisms that are sort of large scale countrywide mechanisms set up and well funded, I should say, to create effective country level investment cases, to do gap analyses, to cost out strategic plans to tackle these other health conditions. And the resources simply aren't there at that level for the NTD community at a country level. And so I think there's a lot we can learn. We don't need to duplicate and create a whole other system, but there's a great deal we can learn from other areas. And a lot of what's been brought up today around the advocacy components of this is what I mean by how investment cases can be well received. I mean, I think on the one hand, the guidance note does a great job of highlighting the importance of creating messages that resonate well, and thinking about different audiences, different perspectives on values. So looking at the agriculture sector, Ministry of Social Affairs, WASH, education, health, etc., and thinking about how all these different perspectives come together. But I would like to push us further as a community to think not just about how representatives of those communities within government receive those messages, but also communities themselves. And we've heard just now from my colleague Togzile some fantastic examples of how effective community-based advocacy can work in concert with government to elevate, Rachel, to some of the points you made about raising the priority of TB in Malawi, and I think there's a lot we can learn as an NTD community there too. I think some reflections from our perspective. I mean, the one country where over the 8 years the End Fund has been around, the one country where we can successfully say we've actually transitioned, we've achieved the outcome, the intended outcome of an investment case without the investment case itself. So we've gotten to the point where the national government has taken over funding from an external source, that is the End Fund, of its national school-based deworming program, for example, and that's Rwanda. I think that's a really interesting example because over sort of actually it's longer than even before the End Fund was around. Some of our initial investors had invested in the NTD platform in Rwanda before we had even been created as an organization. So it's sort of over a decade of a journey together. We got to the point essentially where disease burden was low enough and the health system was strong enough over time that the grants that we had made to the government had helped to elevate the priority of deworming, helped to talk about the educational impact, etc., but incrementally over a very long time period. And I think if we take one thing from what Dr. Malacella told us is that, you know, with the advent of the roadmap now for the next 10 years, we have the first or now second World NTD Day coming up in January. I think that the time is very much now in terms of, you know, we don't have another 10 years to go on that journey that we were able to do with the Rwandan government if we're going to achieve the goals, the targets that are set forth in the 2030 roadmap. And so how can we use investment cases to speed up that process and make the compelling arguments to decision makers? And so just a few reflections from our standpoint. So one of the investment cases at a global level that Rachel mentioned that had come out more recently, Breaking the Cycle of Neglect, was a study by the Economist Intelligence Unit that the End Fund actually commissioned, having seen work that the EIU had done on behalf of the TB community, and thinking about looking at the economic impact, the investment case for that. And we'd seen that be relatively effective in a partnership with the Global Fund. And we thought, well, you know, let's try then to replicate that for the NTD sector. So we commissioned the Economist Intelligence Unit to do this analysis. And just a slight correction that it's actually not a global investment case. It is focused on 4 countries in particular: Ethiopia, Rwanda, Zimbabwe, and Kenya. And it does look at all parasitic worms, the economic impact of all parasitic worms in those countries, the two with the biggest impact being intestinal worms and schistosomiasis. And so across those 4 countries, it did actually find that if WHO targets are met by 2030, by 2040, over $5.1 billion at PPP will actually be unlocked in terms of productivity gains, mostly due to adults being able to be more healthy and contribute to the workforce and their communities, and an additional $1.2 billion, again at PPP, would be unlocked from improved school outcomes as well. So, you know, and I should also say that there's a website for that where there are actually country-specific reports too. So what we have done is with our experience of trying to, you know, support particularly progressive policy environments, in particular for intestinal worms and schistosomiasis. So the governments of the 4 countries I mentioned are endeavoring to even push beyond WHO targets for these 2 disease areas in particular. And so we were able to corral a group of private donors to support that particularly aggressive goal, in large part because of the economic case. Now, we knew that some of the previous economic ROI data in the NTD community was just increasingly becoming more outdated. And so we wanted to refresh that, create a new platform for engagement and effective advocacy. And so we're hopeful that we can use that platform now to engage with 3 groups in particular. Firstly, with government to help just refresh the issue and talk about it in terms that you described well, Doug, in terms of you know, the policy imperative behind achieving the ROI. The second is to incentivize more donor funds to pursue these sort of more audacious and aggressive goals. And the third is to create more public awareness and demand creation. I think the more we can do to connect organizations like Thokozile's around the community-based support, amplify the voices of communities to ensure that government are not just receiving an investment case from an external donor or an international institution. They're hearing the same messages from community-based organizations, faith-based organizations, local implementing partners. So I think we need to do more work as an NTD community to create the right mechanisms to amplify those voices and sort of reiterate the messages that the investment cases can make. And one last thing that I would suggest is that from see in the chat, there's been some questions around public-private partnerships. And I think the NTD community both benefits from one of the biggest public-private partnerships in global health, which is the Pharmaceutical Donation Program for several NTDs. And I think there's a whole lot more we can do to leverage that. I mean, talking about investment cases through mass drug administrations of the generously donated drugs. This donation program creates a tremendous amount of leverage that will not be around forever. And so I think the moment is now for us to come together, reimagine how we can leverage that incredible donation in pursuit of the new WHO roadmap targets. I think the more coordinated advocacy efforts around investment cases at a community level, support from the private sector, as well as to sort of a multifaceted government approach, that coordination is going to be what is going to get us over the finish line. So I'll pause there.
Thank you, Sam. Thank you very much. You reminded me of this sort of idea that neglected diseases are, traditionally or historically and currently perhaps the disease burden of the politically disenfranchised, which lends us towards a more human rights, right to health, leaving no one behind narrative, which has perhaps been insufficient to tackle this politically. Combining this with an economic case, you then have a powerful pincer movement of an argument which combines the economics and the human rights together. So thank you for reminding us of this point about why advocacy is so important in this area. Final speaker, and our time is always against us on these things. We all talk too much. It's probably my fault. Brian, welcome.
Yes, thank you.
How are you? Brian Asari is in the Ministry of Health, Senior Advisor. Give us the government perspective. How do we move the Ghanaian government forward in this area, please?
All right. So I will just share something small in that context. So this is our NTD bedding, as we can see, from hookworm to leprosy. And from 2000 to 2017, some are going up, some are coming down. The list is quite clear, not too different from what we see in a lot of other countries as well. But their main approach here is the vertical programming approach. The funding situation is mainly donor-driven, working with multiple partners. All these organizations are playing one role or the other. If you don't see your organization and you have actually supported country, my apologies. All right, so a lot more organizations are into this space supporting the funding, mainly donor-driven. Meanwhile, the outlook is that there is a context. Our local lower middle income context is quite real. We have donors re-strategizing around funding because of that status. We also have the Ghana Beyond Aid agenda, which is being pushed at the highest level of governance. And of course, our complex epidemiological transition that we are making. So all that is coming into our new health policy, which was launched just yesterday by the President of the Republic. And within that, there's a key focus on institutionalizing funding or domestic resource mobilization initiatives. Of course, that is not alone. It comes with improving allocative efficiency, ensuring that we are managing the existing funds well so we can be able to cover the things that we need to cover. One key thing within that framework is the fact that the universal health coverage financing modalities are currently on the table for discussion. And it will be good for NTDs to find space within that ongoing discussion, just to ensure that the funding or financing mechanisms that we deploy to help us achieve UHC is all encompassing, and that the neglected diseases do not remain neglected in that context of UHC. In terms of specific interventions, there are a few initiatives which are along the lines of corporate social responsibility, which our vertical programs, as I said, they are very collaborative. Some are not really disease specific, but it's a group approach. And these kind of private sector entities actually saw space as people engage them. I'm sure in the process of engagement, they should have actually made a case. I'm not too sure whether the programs have actually used an investment case to engage these private sector entities, but then they will definitely have to make some case to be able to attract kind of corporate social responsibility and engage. Of course, we have been hit by financial sector reforms, which has affected this particular program. But the model is a good model, and I think that the tool that we are discussing today yields itself to application in how we can engage even from private sector along the lines of corporate social responsibility for NTDs. So we haven't done a clear investment case per what we have seen in the guidance notes. However, there are processes that we use to engage our higher levels of governance. By that I mean the cabinet and parliamentary select committees. And as we engage those processes, some of the principles is that we needed to then make a case for costs and benefits. We needed to make a case for scenarios. We needed to make a case for stakeholder analysis to ensure that we have actually engaged all that matter on that particular thing. And when I look at that process and the principles that are highlighted in there, and I compared it with the guidance notes and the approach to the investment case, you realize that there are shared principles within those processes and the investment case approach as we are seeing in the guidance notes. And with that, we also know that then because of shared principles, it should not be too difficult for countries of our kind to actually adapt some of what is being shared today. And this will be very useful, of course. So the tool itself, I think, is a very excellent tool for advocacy. Because of underlying principles, it's easy to contextualize it within our context. It's highlighting a process, which is very important, as well as highlighting the components that countries should look at. And I have seen that, of course, economic analysis and then the ICA, institutional and context analysis are also highlighted well. That is good. And I think that as countries begin to adopt some of these, it will be good for us to, in the process of adaptation, expand on the stakeholder analysis component, because sometimes that is where the inertia and some of the difficulties actually come from when we're trying to set agenda for investments into priority issues. And of course, we also needed to deepen the country systems for economic evaluations. We know that, especially in the LMIC context, not all countries are astute when it comes to data that informs the economic evaluations that should be done to inform an investment case per the structures that we have and are recommending. So then it would mean that countries that would adopt this should actually begin to deepen their internal systems and its ability to generate context-based economic evaluations that will be part of the criteria or part of the components of a typical economic case. Is also what is funded or invested in. And I would want to say that the whole prioritization agenda for policy action, as well as investments, we know that it's also a complex mix of hard evidence, which we see through our economic evaluation component, as well as the soft issues around relationships and networks and camaraderie and timing. And as we blend these two, I think that this is a good opportunity for us to make a case for neglected tropical diseases in our context, especially the countries that are affected the most. Thank you so much, and I would pause for interactions.
Thank you, Brian. It was very good. Thank you very much. Give the government perspective on all of this. I'm looking at my watch, which is telling me we only have 4 minutes. So what I'm going to do is do this. I'm going to ask one question, and I'm going to ask each of the panelists to give their best answer if they can, very briefly. There's been lots of chat, which is all great. What we'll do with the poll results is we'll put them on the website, I think. That's the best thing to do, rather than scrutinize them now. Couple of interesting questions, and I'll combine them here. There's an interesting question from Zhao Huang, who's asked, is there a difference between an investment case for technology introduction and access, and an investment case for disease programs in general? Okay, so put that in your mind, people. The difference between investment case for technology introduction and access and investment case for disease programs in general. And the second part of the question I have is, if it's for disease programs in general, and this is linked to a question that Greg Garrett asked, is if you're looking at NTD health programs, what do you do if the returns are not favorable compared to other disease programs? Do you then keep quiet? And go, okay, maybe we should keep quiet. If you're looking at maybe chronic disease returns or other infectious disease returns, or do you then say, no, hang on a minute, we got a link to these other diseases, and then move towards universal health coverage argument or frame, or actually then start looking at the impacts or connections across sectors as part of your framing and case narrative. So, it's about the framing and what you're valuing in the case. So I think these are important questions about what are you measuring here? What are you valuing here? Now, Rachel, I know you've already answered this question in the chat, so you've already prepared your narrative. So I'm going to give the panelists 1 minute each on this simple question. Thank you. Rachel.
Thanks, Doug. I think you've made a really important point here I want to underscore, because the process of doing the investment case allows one to find efficiencies that might not have been obvious before. So I think that's one key aspect, is that depending on the scope that you have, you can look at integrating services. You can look at the prices being paid for commodities, for instance. And we have found in some countries that no one actually knew what they were paying for some of the necessary drugs. But once we started asking those questions, the information was dug up, and you know what? It can get a lot cheaper than some countries are paying. So there are some great gains to be made, again, in the process of doing it, that, yes, trade-offs are always going to be necessary. I don't deny that, but I don't say that you take a result and you hide it because you don't want to look bad. You say, how can I reframe this? How can I think differently about the question? Because nothing is going to be completely set aside. I mean, that should not happen. But how to do it best is what you're aiming for. Thanks, Doug. Over.
Thanks, Rachel. Read the guidance note, I think, for the full answer. I think it's the easy way of putting it. Wele.
I think in the case of neglected tropical diseases, it's very clear that there's several interlinkages. And so with that, for example, there's interlinkage with animal health, there's interlinkage with education, there's interlinkage with nutrition. And so that in itself brings together a number of key players and key stakeholders and key issues which we can, and I think Rachel's right, the issue is the framing. I think it's the way we frame. And I think because there's not so much work that has gone into NTD country investment cases, I think this is a really good starting point in terms of looking at them. But you have to look at them also multi-sectorally, because all of these interplay with each other.
Thank you. Thokozile.
Thank you so much. I think this is for me, this is a thought-provoking question, really, but then I wouldn't say anything different from what has already been said. Ours was a scenario where we were also learning based on the issues that we wanted to address. So I do share what the previous speakers have already mentioned. Yeah. Over.
Thank you, Toko. Sam.
Thank you. I think in the first question around technology versus disease programming in general, I think in the NTD case, it depends very much on which NTDs are prevalent in the country and where the country is on its journey toward achieving the appropriate goal. So whether that's a control goal or an elimination goal, because the reality is that the closer we get to elimination, that last mile is going to get harder, it's going to get more expensive, and it's going to require new technologies, new approaches that may not be in existence in the NTD realm so far. We're seeing that with the use of geospatial technology for mapping, things like that. And on the second element of the question around where we're placing the value in the investment case, again, I think it depends very much on the country context, where the country is on its journey towards UHC, what financing mechanisms are helping promote that journey. I mean, we've seen some interesting work in both Zimbabwe and Cote d'Ivoire, where the NTD departments have been able to elevate NTDs to the point where the Global Financing Facility investment cases, which is a country-led initiative, brought NTDs to the table for the first time. So there's an NTD rep at that discussion. I only wish that they had a compelling investment case in hand when they got to the table, because unfortunately it wasn't a successful process. And so I think, again, it depends very much on the mechanisms that are being prioritized or pursued at a country level.
Thank you, Sam. Thanks, Sam. Brian, over to you.
Yes, I think I find the question very interesting and exciting as well, because if the analysis for the case, the investment case, is not really giving us maybe what we intended to see, I think first of all, we needed to maybe probably revisit the criteria, how we are using the criteria to actually frame or make the case. If that still doesn't look at it, sometimes the perspective that we have chosen to the building of that argument for the investment case need to be revisited, because sometimes what would paint a certain picture when you take a certain perspective, when you widen the perspective sometimes, or you even alter the perspective sometimes, you could see different pictures. So that is also very important. Maybe sometimes even the assumptions that we have, the underpinning assumptions also needed to be looked at in terms of putting together the case. But then I would also then emphasize, because this question is at the deep roots of what the principle of evidence, the role of evidence in our discourse should be. And I think that if we are able to come to the point where the evidence tells us or directs us in a certain way, we should probably change our advocacy strategy in line with what the evidence is saying. I think that would be my input on this.
Thank you, Brian. I mean, ultimately, it's really what do we value in health, and how valuable is health to society, and how do we frame that discussion and make that case? And this is all part of that process. All that's left for me to do is thank panelists, and Rachel, Mwele, Toko, Sam, Brian, thank you for your inputs and efforts. Thank you for the team behind the scenes, Judith and the Global Health Strategies team, and everybody's been involved in this. Just to remind you that the guidance notes on the website, have a look at it. It's a great read, a lot of stuff in there. This is work in progress. It's an experiment, but we all should keep the conversation going. I should also tell you that the next knowledge product and webinar in the series will focus on planning for access and delivery with research and development for health technologies. And thanks once again to the Uniting Efforts partnership, the team involved. It's Government of Japan, GHIT, and the UNDP-led Access Delivery Partnership and its partners. So it's been fun. We'll do this again soon. Everybody keep the conversation going. And thanks very much. On to other things. I could talk about this all day, but we've got lots of other things to do. So thanks once again, and have a good Wednesday. Over and out.
Thank you very much. Thank you.
Bye-bye, everybody.
Bye.
Thank you. Bye-bye.